Hello. Um, I just wanted to do a small rant just for giggles or whatever for those people who are spoonies, meaning people with chronic illnesses or, you know, family members who take care of or whomever, caregivers. And I was at my mm, neighborhood pharmacy today trying to pick up my Cytotec, which I take 4 times a day. For those of you who don't know, it's also used, we're using it to treat my gastroparesis. I mean, it's not really doing anything, but I'm still taking it 4 times a day. And they use it for ulcers, and also it's an abortion drug. So it's a drug they give to women to abort babies, and so forth and so on. So basically, very powerful drug that if I'm taking it, it must mean there's something serious going on, right? So I've got that, and I'm not feeling too well, but I'm there to pick up my stuff. And as I'm standing in line, looking around, staring at the canes, thinking, maybe I should get a cane, Then I'm looking over at the old guy sitting by the blood pressure machine. Then I look up to in front of me, because I'm the last in line there, and there's a lady filling out her, doing her signature, and the pharmacist is telling her, you can't have alcohol with what you're going to be taking. And she's like, she's an older lady, maybe in her late 60s. She's like, oh, that's fine, you do what I have to do. And I looked down at her legs, and there was just varicose veins, edema, whatever she was taking. I could tell that, life is taking its toll over time. And then, there was a lady who was also at the counter with another pharmacist, and she was probably in her mid 40s, maybe. Looked great. We all chronic illness people can look great, though. Okay. Looked great in the sense of she'd had her hair. You could tell she got new highlights. No roots were showing. Got her tan on. Just a very pretty and well-kept lady. And so then I piqued that conversation. And so she's saying, so every night, I'm supposed to do this every 9 hours. And so the guy who I usually talk to, the pharmacist, the pharmaceutical assistant, whatever he's called, I'm sorry, getting all my words. He says to the other pharmacist across the way, she's asking about the time frame. What can be done? Because she says, yeah, she shouts out, yeah, because that's fine. And this is Connecticut, so this is the way she's really talking. Yeah, that's fine during the week because I've got to work them up anyway by 7, but not okay for the weekend. And my wonderful pharmacist assistant, who knows, there's so many of us who I see on, I'm getting used to seeing the faces of those who are picking up meds and knowing by what they're picking up, we have some serious issues, including some of the people standing right there. And she's upset because she's got to take one medication, and she needs to take that freaking medication every 9 hours. And now she's holding up the line about it, which I am so patient, because when it comes to meds, I'm very patient in line. If you're a pharmacy, there for the pharmacy, then no one takes pharmaceuticals just to take them. Something going on that you need. Especially, there are a lot of older people in my community, and you need to be clear on what you're taking. It's nice to get that pamphlet home, but if there's contraindications, I always ask that question if it's a new med, or just trying to think when I'm there. Sometimes I get home and call them back, oh yeah, I forgot to tell you I'm now allergic to this new thing, and they really take that to heart at this particular place. And so the lady, the pharmacist, is like, yeah, well, and the lady was basically saying, trying to push her to say, can I take it an hour earlier, or if I'm an hour or two late. She's like, you know, really what they want is for it always to continuously be in your system and for it to not wear off. And the girl was like, lady's like, well, you know, like I said, that's fine during the week because I'm already up, but what if on the weekends I want to sleep until 9? If you are a person who is not into foul-mouthed language, I apologize now, and I'm saying this is now the time for you to turn down the speaker if you have kids around, or just shut it off, because I'm about to go off. What in the fuck is the fucking problem? Then she turns around, everybody's fucking line is like, yeah, you know, I'm holding it up, kind of like, what the fuck? Are you serious? One medication that you obviously need because it's some type of time release situation, and you're fucking complaining to the fucking pharmacist who does not live with you about the fact that you have to fucking get up to take that shit in the middle of the night, or not even the middle of the night, at 7 o'clock in the fucking morning on the weekend. Fuck that. Let me explain something to you people out there who aren't chronically ill. I cannot tell you the last time I've slept through the night. I'm trying to stay alive and in good enough health to be at home with my son who's 7 for as long as possible. If I do not take these things that they're telling me to take on schedule, I don't even deviate by an hour or two. Why get into the practice of deviating? You know what I'm saying? That you're just already not willing to commit to your health. Not the fucking pharmacist's health, not the health of the people in the line, but your health. You tell me about your job? Fuck your job. If you get sick enough, your fucking job will let you go. Raise my hand, happened to me, a corporation who knows better than to let someone go because of their health was willing to do so. Willing to face possibly being sued, a lawsuit. They're willing. And it's coming. So, what the fuck? You're young, you're in your 40s, you want to keep fucking tanning like that and shit, and fucking getting your hair fucking highlighted on the fucking chemicals in your hair, which, my God, would send my mast cell activation disorder into overhaul, okay? Then you're going to need to take your fucking medicine. Or don't take the fucking medicine. Or just get the fuck out the line. So when I get up there, alright, and everyone was kind of impatient, which does not happen at this particular pharmacy. It's a town pharmacy that used to be locally owned. It's been there since I was born. I'm 37 this year, and Rite Aid officially took it over some years ago. But before that, it was just locally owned. And so the people who work there are still people from over the years, you know. And so we're all just looking around like, is she fucking serious? And the fact that you turned back to mention it to us, which you shouldn't do, because the sign says for us to stay back here, so we're not in your business, but you know, shit, you're shouting across and everything. Either you want to live or you don't. Either you want to live as a symptom-free life as possible, because no medication wipes out anything 100% if we're talking about the right kind of issue. You know, either you want to or you don't. None of us are going home with your ass. We don't know what the fuck you're going to be doing about your medication. That shit's up to fucking you. Don't sit here and let the pharmacist, who one of them, she was our newer pharmacist, let her put herself, she should not have said that out loud, put herself in a bind so you can come fucking back and be like, but she said, fucking read the shit when you get home. If you got first read it. Get home and read it. Always read the material. It's there for a reason. Read it. I read it, and then if I haven't read the material to whatever medication in, let's say, some months, I read it again just to be sure that something has not changed. A component, something, or maybe they found out about more reactions, because I get them all. I'm usually allergic to whatever is prescribed, and I need to know what the reactions usually are and if I'm having that one. But also, I'm going to take my meds because I went to a doctor. I went to a doctor. And I guess that means that I want help, I think. And then, like, you know, my rheumatologist said to me, Nikki, you know, she had said something I had in the beginning before we knew what I had, and I was on like Plaquenil, because clearly we knew I had some autoimmune issues that are just totally separate from my dysautonomia, okay? We had figured that part out. So I was on Plaquenil and Neurontin and different things, and she had said something about doing something within the diet to tweak that. But she was kind of like, I usually don't mention it. You usually don't mention to your patients, and I love her, so I brought it up, like, you know, sister girl style. You usually don't mention to your patients that maybe they should try this adjustment in their diet first. She said, Nikki, do you know why? Because I am scolded every time. She said, this was the only time it wouldn't have happened. She said, usually the rebuttal is, I can't eat what I want? Oh, no. I'm not, no, give me the pill. Whatever pill you have so that I can eat what I want. I said to her, I said, listen, you know, I don't know what the other patients' stories are. And this was back, I've been on this ride now for 3-4 years. So, you know, I'm 37 this year. I was like, no, I've got a son, and if I want to be as alert as I can for my life and for my son. So if I can try to tweak something with my diet, and it works, because she said it's worked for not a whole lot, a few percentage, but I'm willing to try. The shit didn't work, but, I mean, the fact that she withheld that information because she had been beaten up each time that she mentioned it to the patient. And she's amazing. She's a raw foodist herself, but, you know, but not some just crazy raw food. It's just very natural and, you know, and about it. And she's like, it's no big deal. It's just the way I eat. And, you know, some people have found relief with this certain symptom by doing this. But I just don't. She said I stopped mentioning it because people like bit my head off every time. She said every single time. I mean, listen, either you want, there was a time when there weren't adequate medications. And even the ones they had, those had side effects as well. It's still medication. There's still side effects. You know, I don't want to take the shit. You really don't have to take it. You really don't. It's your fucking life. But if you're standing in the line at the pharmacy, clearly you went to see a medical doctor, an MD. Medical. He practices medicine. Okay? Then go to a naturopath. You went to see a medical doctor who prescribed something. And you took the prescription. Or you wouldn't have, or you would be like, no medications for me. Lots of people do that. I know people who do that. They just refuse all medications. Either you're that person or you're not. So don't get in fucking line and then all of a sudden, you know, asking these crazy babyish ass questions where there's some people behind you who are really sick. So I came up next. Finally, there's some other young woman in front of me. I don't know what she was having still. Sometimes I can just kind of tell, you know. But, and then I went over to my favorite guy. He's gone on vacation. I said, you know, I'm not going to say his name. You know, D, please, you know, you guys have my information. If you come back in 2 weeks and no one's heard from me for whatever reason, because I'm in there few times a week picking up my prescriptions, please call, feel free to call the house and talk to Mom and be sure that I'm not hospitalized or dead. He was like, and he knows what my diagnosis and prognosis is based on. He was like, but you know, we're hoping for the best. And I didn't say anything. I said, like I said, if after 2 weeks you get back and they mention that I haven't been around, feel free to call my mom and to see what's going on. Because, you know, you hate to lose patients who are there, then all of a sudden they're just not there, especially at my age, where I know there's some complications with some things that have been going on with me. There's been so much. I'm making myself sick doing this because it's crazy. There's so much going on that I just don't even update you guys anymore. Because it's like, I would be on here for like, I just can't do it. I just can't do it all the time anymore. So there's a lot of things, and they're cute, and they're fast, and they're progressing. They're brand new, and they're progressing fast, and over a month, in less than a month. So, you know, just letting him know, we know what's been happening, and certain things could happen in 2 weeks is a lot when you have a progressive illness that seems to, at the moment, be moving really fast. I'm sorry, guys. So, whatever. Listen, stay out of the pharmacy if you don't want the drugs. There are some of us who have symptoms, and we have to weigh the good and the bad and take the shit. You know, we would all like to be naturopaths. I would love to live a fully natural life, but freaking this is America and planet Earth, and people have been taking medicines since, my God, get out the freaking line so that the rest of us don't even feel, that just makes you feel funny as it is. Like, one medication? One. And there are some that I've told doctors, let's not do that one. I have a list that I could be on, but I'm like, based on the fact that I'm a mom and of a really young child, I've got years to build with him. I want to be coherent. You know, that's important to me, so I'd rather freaking diaphragm. I want to be coherent. And one of my specialists in the beginning, my first dysautonomia specialist, she was upset with that I didn't want to, I was on like a lot of Neurontin, like 1,500 milligrams or something, like 3 times a day, something crazy. And I didn't want to take my clonazepam consistently each day, because I had been there and done that and wound up in inpatient psych. So I said to her, I don't want to. I still take my clonazepam, and when I take it, I'm always in constant communication with my psychiatrist. If I've started taking it more often, let's say I take it once a day, every day, and that's only half a pill, I don't mean like a whole pill, I let her know that I'm on that kind of protocol. My body is doing certain things. I'm taking it this often. You know, I need you to help me monitor what's going on. And so I don't take that. I don't take any medication lightly. You know what I'm saying? And I appreciate all the medications that are helping, deteriorating me one way, but helping me in another, to have a different quality of life with my son. That's my choice. With or without the medications, we're all gonna die. That's the end of the story for every human being. No one leaves this earth alive. That's just how it goes. The game, you know. So what you choose to do about your physical and mental health while you're here will all depend on your circumstances and what you have going on, your culture, so many different things. But shit, if you don't want to take something because you gotta wake up at 7 o'clock, 7 days a week, don't fucking take that shit. It's up to you, not the fucking pharmacist. I'm just saying. Pumpkin nozzles, everybody. Alright, I'm out. Like Dana would do. Peace.